Here, you can be your best. The best train here. Learn here. Succeed here. Perform here. Win here. Thrive here. Itawamba Community College. The best start here.
Why settle for a checking account that just holds your money? Renaissance Rewards Extra gives you so much more. Like savings at more than 400,000 retailers, 24/7 roadside assistance, a cell phone protection plan worth up to $400, $25 in ATM fee refunds per monthly cycle, and a great interest rate when you meet 3 easy qualifications. Get extra today at rewardsextra.com. Renaissance Bank, understanding you. Member FDIC.
Good afternoon and welcome to another edition of the ICC Hour here on Super Talk Mississippi. I'm Adam Gore, the Sports Information Director and Director of Media Relations here at Itawamba Community College. And as always, I greatly appreciate you guys taking time out of your Tuesday afternoon to join us here for the show. And as always, the ICC Hour is being presented to you by our friends at Renaissance Bank.
Ooh, fumble. Let's give her a Renaissance replay. Make the right call with Renaissance and get cell phone protection with Renaissance Rewards Extra Checking. Sign up today.
On this week's show, we'll talk with Dr. Mary Linda Moss, who is a breast imaging radiologist with the Breast Care Center at the North Mississippi Medical Center in Tupelo. With it being Breast Cancer Awareness Month, Dr. Moss will tell us more about the importance of routine exams, some of the advancements that they have in place at the Breast Care Center. She'll also talk about what groups of individuals that may be at a higher risk to be diagnosed with breast cancer, and she'll have a lot more great information that you'll want to stick around for in our first 2 segments of the show. Then later on in the show, we'll preview some of our special offerings here at ICC, including our Food Pathway Program, our Early Childhood Development Program, and our Forestry Program as well. Now, if you or someone you know would like to get more information on classes or some of the programs we have to offer here at ICC, I encourage you to visit iccms.edu. That's iccms.edu to learn how ICC can help prepare you for a better tomorrow. We're going to step away and hear a word or two from our sponsors, including our presenting sponsor, Renaissance Bank. And when we come back, we'll talk with Dr. Mary Linda Moss here on the ICC Hour.
Playing on tour takes years of dedication, hours of practice, focused precision, and nerves of steel. That's how you become great at the game, but not how you should bank. That's why Allie Ewing chose Renaissance Bank. Their easy-to-use app makes banking a breeze, no matter where she is. Renaissance Bank, understanding you.
Everyone has a unique story to tell. Maybe your story has you performing your new song in front of a crowd, getting to play your favorite sport, or enjoying a horseback ride in the country. At Orthopedic Institute of North Mississippi, our group of skilled surgeons understand your need to continue your story. That is why we are the preferred choice for orthopedic care. Thank you for choosing us. Our story is you. Orthopedic Institute of North Mississippi.
Ever since we opened our doors in 1964, Davis Ford in Fulton has been committed to providing the highest level of customer service and customer satisfaction. That level of commitment is shown in our 18 Ford President's Awards for overall customer experience. Whether you're looking for a tune-up, a trade-in, or a new F-150, the team at Davis Ford is here to serve you. Come see us today in Fulton. Call us at 662-862-3711 or visit us online at davisfordsales.com. Davis Ford, small town dealership, small town prices.
That's home. That's just like the Ravens. That's just like Pahokee, Florida. That's my second home. I got my degree from there, my first degree, college degree. It's part of my heart, it's part of my soul, it's part of my spirit. And, you know, it's everything. Itawamba Community College, baby, it's everything. It shaped me up to being a great man because it was part of the journey of me becoming the young man I am today. And it's home, man. That's it. Like, I can go there and lay my head down without no problems. Itawamba Community College, the best start here.
Little Caesars is now the official pizza sponsor of the NFL. Let's go! Come on, keep it hot.
It's good! Pizza, pizza?
Again.
Harder, readier! Let's go, let's go! Pizza, pizza.
Pizza, pizza. No! Pull! High five!
Pizza, pizza!
Come on!
Pizza, pizza!
We're ready!
Enjoy game day with a Fanceroni Pepperoni with over 100 Old World pepperonis.
Pizza, pizza.
They say Diet Coke is a mom's drink. Well, you copied her jeans, her spin, her shoes, her scrunchie, and whether you realize it or not, her music. Now, copy her drink. Drink what your mama gave you.
Hey, honey, could you help me with this? Today tastes like staying in. And it never tasted this good.
Why settle for a checking account that just holds your money? Renaissance Rewards Extra gives you so much more. Like savings at more than 400,000 retailers, 24/7 roadside assistance, a cell phone protection plan worth up to $400, $25 in ATM fee refunds per monthly cycle, and a great interest rate when you meet 3 easy qualifications. Get extra today at rewardsextra.com. Renaissance Bank, understanding you. Member FDIC.
And welcome back to the ICC Hour here on Super Talk Mississippi 101.9 FM. And as always, the ICC Hour is being brought to you by our friends at Renaissance Bank. Renaissance Bank, the bank that understands you. Visit renaissancebank.com for more information. Well, October is Breast Cancer Awareness Month, and that's one thing that we're going to focus on the show today. And I want to welcome in our guest, Dr. Mary Linda Moss. Dr. Moss, how are you doing today?
I'm doing great. Thank you for having me.
Well, first off, let me thank you for coming on the show. I know you have a very busy schedule, so we'll kind of just jump right into it. Kind of tell everybody who you are, where you work, and just a little bit about yourself.
Okay. So I am with the Premier Radiology Group here in Tupelo, and I'm the imaging director of the Breast Care Center, which is associated with North Mississippi Health Systems. And I have been here for about 4 years. Before that time, I was in Jackson, Mississippi, where I worked at Women's and River Oaks Hospital and did a lot of breast imaging there as well. But I've been here for about 4 years, as I said, and have thoroughly enjoyed Tupelo. This is a great place to work. We have some just really caring, sweet techs and nurses, and it's been a pleasure. It's definitely a step up to come here and get to work with all of these wonderful women and see these. We have fabulous patients, and it's been good.
Absolutely. Well, unfortunately, one in 8 women will be diagnosed in their lifetime with breast cancer, and that's kind of an alarming number, because if you think about just how many people are around in a day, and you can look around, say in your office or maybe even your household or your social group, it's going to affect you one way or the other if it hasn't already. So just kind of talk about the prevalence of breast cancer.
Sure. So you're correct. 1 in 8. The latest numbers suggest that it may even be as prevalent as 1 in 7.
Oh, wow.
Women will get cancer in their lifetime. It is the most common cancer in women. Approximately 40,000 women die from breast cancer every year. 40,000 is a lot.
It is.
Another interesting fact is something that I think is important to realize, that, you think about breast cancer and you think the little, 75, 80-year-olds that get breast cancer or whatever, but 1 in 6 breast cancers are found in women between the ages of 40 to 49. We've also seen it in patients as young as 19 here. And so it is, it does tend to strike basically almost any age group. Mm-hmm. Another thing that I think is important is just by the fact that you're a woman, you're already at average risk for developing breast cancer. And what I mean by that is there's really not anybody who has a low risk.
Right.
Till 3 years ago, I had no family history of breast cancer. And so, 75+% of all breast cancers are not genetic.
Really?
So a lot of people tend to take this false security in the fact that they don't have anybody in their family who had breast cancer. So their risk is probably low. But in actuality, that's false. Certainly, if you have a genetic predisposition, your risk is going to be higher.
Right.
But the fact that you don't have one does not mean, well, I don't have to go get a mammogram this year. I mean, nobody in my family has breast cancer. Everything's cool. I'm good. It can turn on a dime, number one, and you suddenly do have somebody in your family who has breast cancer, and I can attest to that. But you also, it doesn't matter. You're still, you're at least at just medium risk if you're female.
Yeah, and that was one of the first things I wanted to talk about was some of those risk factors, and you talked about it there as well. So so it could be genetics, it could not be genetics. So really and truly, it's like any cancer. It's just it doesn't have any things that's like, okay, this is the type of people I'm going after. It could be anybody.
Right. Well, much of breast cancer is mediated, or its development is driven by the female sex hormones. And so anything that either increases the amount of those hormones or increases the time at which you're exposed to them is going to increase your risk as a female. It's not necessarily a modifiable or a changeable risk, but if you start menarche, at a really early age, or if you don't have any children, when you're pregnant, some of that stimulation then ceases. And so the earlier you have a child, that does lower your risk a little bit. The more children you have, lowers your risk a little bit. If a woman enters into menopause at a much later age than most, then her risk is going to be higher. And that's because that monthly variation of the female sex hormones does increase your risk. We talked about, some genetic risks. There are some interesting, for some reason, if you have an early growth spurt, and taller women have been shown in multiple research studies to have a higher risk of breast cancer, which, who knows how much higher risk, but they've just seen it more frequently in those patients. But there are a lot of modifiable risk factors that I think are important for people to know. And the number one modifiable or changeable risk factor is obesity, or an elevated BMI, or body mass index. It's now known to be a major risk factor for breast cancer, and studies have shown that by maintaining a healthy weight, and particularly with regular exercise, you can lower your risk significantly. Smoking, excess alcohol consumption, vitamin D3 deficiency, and some hormone therapies. Research kind of goes back and forth on whether or not birth control increases breast cancer risk. We think it does, but the degree to which it does, we're not exactly sure. And, then as women get through menopause and want to have some exogenous estrogen or progesterone to control some of those symptoms, there is some associated risk, especially with the non-bioidentical, the pharmaceutical grade estrogen and progesterone. But, I think one takeaway is, just like with any other cancer, not leading a sedentary lifestyle, trying to control your BMI, those things definitely, they cut down on the amount of inflammation in the body. And inflammation, we know, is linked to cancer and other disease development. I don't know very many oncologists who don't exercise regularly. I mean, they've seen it, they know it, and they take it seriously. And so, for the rest of us, that's a message we would like to get out, is the importance of trying to cut down on that inflammation. And a great way to do that is to, have a normal body mass index and to, spend that time on the treadmill or outside walking, or, however you choose to get your exercise, but just to really, focus on being healthy and doing everything you can do. And then, that doesn't guarantee, obviously, but anything we can do to lower our risk, given that it's such a prevalent disease, that it is just so common.
Absolutely. And we're talking with Dr. Mary Linda Moss, breast imaging radiologist with the Breast Care Center, which is located on the North Mississippi Medical Center campus in Tupelo. A lot of great information there. So one of the things is, education. As you said, you want to be able to educate yourself, know that you can exercise to help, how to help prevent these. But let's talk about detection and how important it is to, know what to do, that early detection and things like that.
Sure. Well, so the basic screening test, the kind of gold standard for breast cancer, is mammography. It uses low-dose x-rays to detect an abnormality within the breast. And mammograms can't detect every cancer, and they can sometimes detect tissue that looks like cancer but is not. The more classic or 2D sort of mammogram that has been around for a while. Takes a view from the top to the bottom. We compress the breast. And the reason we do the compression, though it sounds like some sort of archaic, we just want to cause pain,
right.
But it's not. The reason we compress the breast is to really spread that tissue out, because with the 2D mammogram in particular, you're taking an image from the top of the breast all the way through the bottom of the breast, going from your head towards your feet. And that's one plane. And that's, and anything that's on top of each other, it's not going to be separated. It's just going to look like either a bigger mass, or it may just hide things completely. And we also do one kind of a side-to-side view, again, compressing the breast. And we try to put those two views together and in our minds sort of 3D orient where an abnormality might be. But we have newer technology now that is called tomosynthesis, which is more of a 3D type mammogram. And what it does is, instead of just taking two views, we do compress the breast in both of those planes, but then the tube in an arc moves over the patient and takes multiple images at different projections. And then those images are reconstructed with a computer algorithm. And it's almost like it's giving you thin slices through the breast by the time the computer finishes reconstructing it. So instead of having just really 4 pictures, 2 of each breast to look at, we have hundreds of pictures that allow us, better spatial orientation, but it allows for better separation of things within the breast so that masses are a little easier to see. And benign things, it's a little easier to tell that some things are not going to be a cancer. So it, in theory, will significantly increase our cancer detection rate, but it also should decrease that number that it's called a callback rate. And it's the number of patients from a screening mammogram that we have to call back in for additional imaging. That's, associated with significant fear and anxiety. And so we try to do that as little as possible. But if we don't call back some patients that we think are normal, sometimes we're fooled and we see something that we think is probably okay. We call it back and it ends up being a breast cancer. A lot of the time we call something that looks almost identical to that back and it's benign. And, about 10% of all patients will have a callback, on any given day from the screening mammograms that they've had. And so what I'd love to do is try to alleviate some of the fear and the anxiety that patients feel when they get called back, because of that 10%, only 2% will probably go on even to have a biopsy, and less than that will actually have a breast cancer. And that's because as a screening test, you have a big group of patients. You're trying to narrow that down to the more suspicious ones. And then from there, you determine which ones have actually, a significant chance of having breast cancer, and which ones are like, nope, you were fine. That was just some tissue overlapping, or, one of the other many benign, possibilities.
Absolutely. And I know that's your favorite part, is whenever you're able to tell a person that that's the way it is there.
Why settle for a checking account that just holds your money? Renaissance Rewards Extra gives you so much more. Like savings at more than 400,000 retailers, 24/7 roadside assistance, a cell phone protection plan worth up to $400, $25 in ATM fee refunds per monthly cycle, and a great interest rate when you meet 3 easy qualifications. Get extra today at rewardsextra.com. Renaissance Bank, understanding you. Member FDIC.
Over 100 crispy Old World pepperoni.
Cheesy crust edge.
This Fanceroni pepperoni from Little Caesars is fancy.
Am I fancy enough for the Fanceroni? I'm wearing cargo shorts.
But Tim, me too. Fancy isn't measured by your inseam. Fancy comes from here. 'Cause if you are what you eat, then we're all feeling mighty fancy today.
Yeah! Try the Fanceroni pepperoni with over 100 Old World pepperoni.
Pizza, pizza. When I came back to school this year, I brought my bank with me. And the student checking account at First American National Bank was perfect for me. No monthly fees and no minimum balance. And I can manage my money right from the app. I can do all my banking with text messaging if I want. And I can deposit a check just by taking a photo. It's that easy at FAMB.
I took my bank to college with me.
I took my bank to college with me.
My bank followed me to college.
I took my bank to college with me.
I took my bank to college with me.
It's that easy at First American National Bank.
Ever since we opened our doors in 1964, Davis Ford in Fulton has been committed to providing the highest level of customer service and customer satisfaction. That level of commitment is shown in our 18 Ford President's Awards for overall customer experience. Whether you're looking for a tune-up, a trade-in, or a new F-150, the team at Davis Ford is here to serve you. Come see us today in Fulton. Call us at 662-862-3711 or visit us online at davisfordsales.com. Davis Ford, small-town dealership, small-town prices.
Everyone has a unique story to tell. Maybe your story has you performing your new song in front of a crowd, getting to play your favorite sport, or enjoying a horseback ride in the country. At Orthopedic Institute of North Mississippi, our group of skilled surgeons understand your need to continue your story. That is why we are the preferred choice for orthopedic care. Thank you for choosing us. Our story is you. Orthopedic Institute of North Mississippi.
Playing on tour takes years of dedication, hours of practice, focused precision, and nerves of steel. That's how you become great at the game, but not how you should bank. That's why Allie Ewing chose Renaissance Bank. Their easy-to-use app makes banking a breeze, no matter where she is. Renaissance Bank. Understanding you.
Welcome back to the ICC Hour presented by our friends over at Renaissance Bank. They are the bank that understands you. Now back to our conversation with Dr. Mary Linda Moss here on the ICC Hour presented by Renaissance Bank. Now let's talk about like self-exams. How can they, maybe get early detection through self-exams?
Well, and that's, early detection, the key to early detection is that it's going to decrease the breast cancer death rate, and it also means that treatment can possibly be minimized as opposed to much later detection where treatment has got to be much more excessive and much more difficult. Self-exams are important, but, they're really only going to help you. A lesion has to be decent sized typically before you can detect it with a self-breast exam. But if you are good about doing your self-exam every month, even patients who have, what they refer to as sort of lumpy bumpy, I don't even know what I'm feeling, help me, it doesn't do me any good to examine myself. If you do an exam every month, eventually you become aware of what's normal for you and what's not. And so an abnormal finding sticks out to you a little bit better. So it is important to do that every month, even if you have the lumpy, bumpy, difficult to examine breast, because you can become really accustomed to what your breast tissue feels like and then detect an abnormality earlier. I would not, go to self-exam and think that that's going to be enough, just because typically by the time it's palpable, it's pretty sizable. Right. We also have ultrasound. And in some of our younger patients, that's where we start because there's no ionizing radiation associated with ultrasound. And it's a good tool when there is an abnormality. There are some screening ultrasound exams that are available that we hope to have here soon. But it's a whole breast ultrasound kind of thing that is a great tool, and hopefully we'll have that here. But really right now, ultrasound is really more used in the diagnostic setting, meaning there's an abnormality, whether it's a palpable concern or there's breast pain, or there's a finding on mammography and we want to evaluate it further with ultrasound. So, that's another tool we have. Breast MRI is a tool that we use not infrequently. It's a great tool. It has a 98% sensitivity, which means if you have a negative breast MRI, you have a less than 2% chance of having any sort of missed cancer. And the numbers are not that good with ultrasound or mammogram. They're good, but they're not that good. If you have really dense breasts, mammograms are going to detect about 60 to 70% of breast cancers in somebody that's got that classic really dense breast tissue. If you've got more fatty replaced breast tissue, mammograms are going to detect, upwards of 90% of all of them, maybe closer to 95. So it's variable based on the way your breast tissue is made. But the combination of factors and that consistency. If you're going somewhere to have your mammogram, either stay at that place and continue to go so that they have previous year's mammograms to compare with, because sometimes the only difference, the only sign of a breast cancer is just a subtle change.
Mm-hmm.
So either stay at that place, or if you want to change to a place, you want to come see us, for instance, be sure to bring your old films with you or have them sent to us so that we can then get all of your films loaded into our PACS system and compare, not just this year with one before, but we try to compare with several years prior so that we can detect any subtle changes and get moving on those.
Okay, and it sounds like to me consistency is a big key in it. One, consistency with yourself, consistency with your doctor in that sense. So, yeah, I think that's a lot of great information there. So let's talk about, you touch on it for a minute, the monthly self-exams or, talk about that age group, how often they need to be screened, how, at what age do you need to start maybe taking a little bit more serious in those sense?
Sure. So there are multiple schools of thought out there right now about when to start screening, how frequently to screen. The American College of Radiology and the American College of Surgeons both agree, and I strongly believe that breast cancer screening should begin in average risk women should begin at the age of 40, and it should be annual, until, and the end point is, sometimes obviously people pass away and that's your endpoint. But as we see an older and older population of patients, we do mammograms on patients into their 90s. I think when the life expectancy is less than 5 to 10 years, at that point, it's not likely that a breast cancer that you develop at that point is going to be the thing that gets you when it's, only detectable by mammography. So, that kind of is a discussion to have with your referring physician as far as at what point do you stop. But at what point you start, I would say average risk, no family history, no genetic factors, not significantly overweight. I think 40 is the time to start. Now, there are certain Jewish populations, African American populations who have a little bit higher risk. And at the very least, they need to start screening at 40, but it's advisable to have a risk assessment at the age of 30. And that's with your primary care physician, your OBGYN. They can help you establish what your risk is and when you should start. If you have a family member, for instance, who, say your mother developed breast cancer at 35, then you want to start screening at least 5 years prior to the date at which your closest family member developed breast cancer. So, in those particular patients, they need to start earlier.
Mm-hmm.
But your average risk is to start at 40. You want to do your breast self-exam every month, see your physician every year, and then have your mammogram every year. And a lot of times the, mammogram will coincide with that, gynecology visit just to keep things, in order. But I think those are the primary and the most commonly accepted screening recommendations right now.
Okay. Now, when you talk about mammograms and things like that, can they do those locally? Of course, I told you I didn't know a lot about this coming in there, so I feel like this might be a great way to educate other people in my shoes. Do they need to set up an appointment through you guys, or what do you need to do on that?
Yeah, so we do take unreferred patients, but most of our patients come from, primary care, from gynecology. We have surgeons who send us, a lot of patients, and just in their routine visits, the patient's routine visits with their physician, usually they will check to make sure that they've had their mammogram in the past year. And if not, they can schedule that here with us. Our outlying facilities also have that new tomosynthesis, that 3D mammography. All of them have recently gotten brand new state-of-the-art 3D tomography units. And so, that includes Pontotoc and Amory and Eupora and Iuka. And I hate to start naming because I'm going to miss somebody, but Hamilton and West Point. I mean, all of our outliers now have the ability to do tomosynthesis, which is just a better mammogram. Is basically that's the breakdown on it.
We're talking with Dr. Mary Lindy Moss, Breast Cancer Awareness Month here, and she's shared a lot of great information. This will be available if you want to go back and listen to this interview. You just search the ICC Hour on YouTube. Dr. Moss, let me ask you something. And this is, mental health is becoming something that's a lot more in focus than it has been in the past. Do you guys offer, like, say, support groups for people that have been, that have breast cancer, or anything like that over there on the Tupelo campus?
That's a great question. And I have actually asked several times about trying to make sure that we have some support groups for our patients. And I believe there are some at behavioral health, but I really don't know how frequently they meet and how big those groups are. We have a geneticist who kind of coordinates a lot of that stuff, and we also have a breast navigator. And the breast navigator, along with the geneticist, help these patients who are recently diagnosed with breast cancer. They help them navigate the social and mental health issues of the disease a little more than I actually do once my part's a little bit done with the biopsy and talking with them about their diagnosis and getting them set up with a surgeon and that sort of stuff. Then we have other people who kind of direct them from there. But I do think that that's vital. And I think breast cancer is an overwhelming disease, and it does kind of, it's that gift that tends to keep on giving even when you think you've gotten it beat. So
absolutely.
Better not to get at risk.
Yes. Well, Dr. Moss, before I let you go, I kind of just highlight some points that you want to make sure that our listeners understand, that they know how they can identify some risk factors, how, the detection and things of that matter. Just kind of a high point those for our listeners.
Sure. I think number one is for all women to consider having a risk assessment by the age of 30 to know when they should be screened. Screening for breast cancer is easy, it's safe, it's effective. And, for an average risk woman starting at the age of 40 and considering mammogram, it's a yearly thing you need to do. I think that is important. And I also think that we tend to minimize the fact that breast cancer can occur in younger women. As we talked about, 1 in 6 occur in women ages 40 to 49. And that just because you don't have a family member who has breast cancer, it doesn't mean that you're safe. Over 75 to 80% occur in patients with no family history and no genetic factors. So we just, it's being aware and knowing that you can't ever be low risk for breast cancer if you're female, hopefully will help people take it, seriously and be sure to get their annual exams, do the things that they need to do to minimize their risks, and talk with one of us if they have questions or have an issue.
And absolutely. And how can they get in touch with you guys there in case they do need to talk to someone?
Okay, so the front desk at the Breast Care Center number is 662-377-4910.
Awesome. Well, Dr. Moss, I appreciate your time today. I know you're extremely busy, and thank you for everything that you and everyone over there on the Tupelo campus of the North Mississippi Medical Center at the Breast Care Center do to kind of make what is a very serious, very stressful time for a lot of people a little less scary. And I know that's tough because you've experienced personally. And again, thank you for all that y'all do.
Well, thank you, and thank you for helping us get this awareness heightened out there. I appreciate that.
And we'll be back with more of the ICC Hour right after this.
Playing on tour takes years of dedication, hours of practice, focused precision, and nerves of steel. That's how you become great at the game, but not how you should bank. That's why Allie Ewing chose Renaissance Bank. Their easy-to-use app makes banking a breeze, no matter where she is. Renaissance Bank, understanding you.
Hey Indian fans, I'm Ricky Murphy, real estate agent, Tommy Morgan Realtors, and I'm also a proud alumni of the All-American Marching Band. Itawamba Community College was my home for 2 years, and where you decide to make your home will be one of the most important decisions of your life. Whether you're looking to create a plan to buy your first home, or if you're ready today to make a move into your forever home, give me a call or send me a message so we can discuss your next move. And for my family, roll Tribe!
Ever since we opened our doors in 1964, Davis Ford in Fulton has been committed to providing the highest level of customer service and customer satisfaction. That level of commitment is shown in our 18 Ford President's Awards for overall customer experience. Whether you're looking for a tune-up, a trade-in, or a new F-150, the team at Davis Ford is here to serve you. Come see us today in Fulton. Call us at 662-862-3711 or visit us online at davisfordsales.com. Davis Ford, small-town dealership, small-town prices.
Little Caesars is now the official pizza sponsor of the NFL. Let's go! Come on, keep it hot.
It's good. Pizza, pizza.
Again.
Harder, readier. Let's go, let's go. Pizza, pizza.
Pizza, pizza. No, pull. High five.
Pizza, pizza.
Come on.
Pizza, pizza.
We're ready.
Enjoy game day with a Fanceroni Pepperoni with over 100 old world pepperonis.
Pizza, pizza.
Tomorrow. Tomorrow is what we anticipate, what we work for, what we want to improve. At Itawamba Community College, we offer the courses, pathways, and the training that can help turn your vision of tomorrow into a reality. So why wait? Your tomorrow can start today at Itawamba Community College. The best start here.
Why settle for a checking account that just holds your money? Renaissance Rewards Extra gives you so much more. Like savings at more than 400,000 retailers, 24/7 roadside assistance, a cell phone protection plan worth up to $400, $25 in ATM fee refunds per monthly cycle, and a great interest rate when you meet 3 easy qualifications. Get extra today at rewardsextra.com. Renaissance Bank, understanding you. Member FDIC.
When my mom opened the store, I got comfortable with it, and I liked the fact I like to help people, and I like to make people feel good about what they wear or just in general. And so once we got started and got into it, it was just one of those things where I just kind of really fell in love with it.
This is a 2-year all-online Associate of Applied Science degree. There are no restrictions or requirements to begin working toward a Business and Marketing Management Technology degree.
I think just being here and being able to experience what all there is within business and marketing, it was just something I thought I would really enjoy, which I started the first semester I was in class, and which I loved Miss McCrimmon. She was awesome. She was very helpful.
Students simply apply to ICC and then select Business and Marketing Management Technology as their major.
I enjoy online, and it was not anything that anybody couldn't do. It works with your schedule, and it was easy for me to do online working here as well, so that was really helpful to me.
This degree covers a wide range of business jobs. It's also a great way for entrepreneurs to learn about starting their own business.
There are times when you will catch yourself applying what you did learn in the program, using it within whatever business you're in.
Many students in this program are working and are interested in earning a degree to be promoted where they work. I've also had graduates start their own businesses.
There's just something about when somebody comes in and they want to find something and you're able to help them with that, and they find the perfect outfit or whatever they're needing. It's just one of those things where it makes you feel good and it makes the customer feel good.
Students can start the MMT program in the fall or spring semesters.
But overall, it's a fun job, and you get to learn a lot. And if you love shopping, that's a big plus too. Customer service is huge, and we want to make sure that we are able to fit that person's needs and do the best we can to help them.
MMT graduates also have the option to transfer their associate degree and continue working toward their bachelor degree online.
Electrical technology here at ICC is a program where we take students in and teach them from the fundamentals of what electricity is all the way to very advanced concept. It takes 2 years, it's 4 semesters, and you would always have to start in the fall because the courses are taught fall and spring. So in other words, the courses that are offered in the fall are not offered again in the spring, so you have to start in the fall, and it takes 2 years. There is a huge demand right now for electrical technicians in the workplace. As we all know, manufacturing has gotten very automated and very technical, and we meet that need with our program here. So our students they're definitely going to have opportunities once they graduate, even opportunities while they're going to school here through the internship program that we have. Most of our students on the internship program are in that $14 to $16 range, and then once they graduate, and most industries does a pre-employment exam, and then they test to see where those students will fit into their pay scale. I would say that most of them fall in that $18 to $22 an hour after graduation. So it's a really, really hands-on program. So that's another thing that students need to be aware of. If you enjoy working with your hands and the physical aspect of using tools and doing a job, then this curriculum would be something that you need to look at. There is a good bit of programming, but you're not just going to be a programmer. You know, you're going to be a multi-skilled electrical technician, which means that you'll do all of the skill sets, not just the programming. Electrical technicians in manufacturing the number per manufacturing facility is going up because the technology used in all of manufacturing is going up exponentially. I mean, we just get more and more automated and autonomous in our manufacturing processes, which means that we have to have a really skilled person to maintain those processes and keep them functioning. So the maintenance technicians today are all, by and large, have a huge electrical background to be able to do what they do with the automated processes that we manufacture today. And it doesn't matter what you're manufacturing, whether you're building cars or tires or body parts, or, you know, it doesn't matter. All manufacturing processes are automated at a really high level today and continuing to grow in that area.
HVAC stands for heating, ventilation, air conditioning. It is a trade program that is dealing with home repairs to industrial refrigeration repairs like you'd find in a convenience store to a supermarket. The degree program is 2 years. It is 4 semesters at 15 hours each semester. There's about 15 hours of academic classes that will be needed to be taken for the degree. With a 2-year degree, a person should be able to get a job doing repairs, to being a service tech for a local company, to being a self-employed individual. During the program, we get the EPA certification, which allows people to handle the refrigerant and the charge of systems. There's also NATE certification that are available to students at completion of a 2-year program. An entry-level person can probably experience pay in the neighborhood of about $14.50 to $17 an hour, with raises going up to the points of $22 to $23 an hour. The demand for HVAC technicians has been really well for the last few years. A lot of the technicians are older people that are at retirement age and are leaving the field, so there is a big demand for new, experienced personnel. The curriculum is made up of 12 classes in the HVAC that are 3-hour college credit classes, starting out with levels of someone not having any experience to getting a person to the level of getting a job or becoming self-employed. There's also 15 credit hours of academic classes for the associate's degree that can be done online or in the classroom on the Tupelo or Fulton campus. I like this industry for the reason of being able to go different places every day for a work environment. It's not always at the same location. The other thing I like about this is a field that's easy to start your own business. Nationwide, 1 out of every 7 that finish a 2-year degree end up owning and operating their own business.
So industrial maintenance technology at ICC is a 2-year degree program in which we train students to go into manufacturing facilities and be industrial maintenance technicians or multi-skilled maintenance technicians, to operate machinery, to manipulate and repair machinery and manufacturing processes so that manufacturers can efficiently make their products and maintain a certain production rate. So enrollment is selective admission. You apply for admission to college like you would any other program, and then you also submit an application for industrial maintenance technology. So the demand is very significant at this point in time, and it has been for a number of years now. All manufacturers in the area have maintenance jobs that are open. We constantly receive calls and requests for qualified maintenance personnel. However, we don't produce enough at the moment to fill all of those positions. On the very low end of the scale is, in the range of $16 to $18 an hour, equates to around $45,000 a year before overtime. And then after several years of experience and topping out, we have maintenance personnel in the area that are making well over $100,000 a year, including their overtime. Most of the classes are taught at Belden. The few academic courses, the 18 hours of academics that are still taught on either Fulton or Tupelo or online. The curriculum is heavily electrical based because a maintenance person has to be an electrician first and then add additional skills to that. So for people who like to work with their hands, they like to figure out problems and fix problems, this is usually a really good field because not only does it give us the ability to exercise those things, it also is a very stable field as far as a job goes, a career. Like I said, everybody in the area is looking for maintenance personnel. So the job availability is there, the ability to sustain a job, and then the pay on top of that is pretty lucrative compared to most other jobs.
Precision manufacturing and machining is the process of taking raw materials of any type and making an end product or a component for another type of product. The Precision Manufacturing program is a 2-year degree program. So with our degree, there's a couple different avenues we can take. Some students go directly into the tool and die field. We also go into general machining, which is the taking of raw materials and making just in parts or products or pieces or whatever the case may be. Our program does offer certifications. It is through the NIMS Corporation, which is a National Institute of Metal Society, and they do offer certifications in each individual component of our program, whether it be in milling machines, turning lathes, CNC mills and CNC lathes. So those are national certifications. Demand for our students is high at this moment. We do have employers from all around our area and outside our area calling, looking for students with our skills. The average salary for precision machining, especially in the CNC field, is around $65,000 to $70,000 a year. But most of the times our class does top out around 20, and it is open enrollment. So all of our core classes are in one large shop, or lab as we call it. We're here on first year students are Mondays and Wednesdays, usually from 8 o'clock to about 4:30 on Monday and Wednesdays. Second year students are Tuesday and Thursdays from 8 to 4:30. So all classes are at Belden. With the Precision Manufacturing program, we do have internships available. A lot of industry in our areas do come in and offer internships through our internship program every fall. Gene Haas Foundation is a major contributor to our program. They are big in education, so we do get a grant every year to help subsidize some of our students' tuition costs.
The robotics program at ICC is a program that allows the students to learn about industrial grade robots that are used in local companies and also in companies globally. The robotics program is a 2-year degree, and after the 2 years, typically the students, when they graduate, they'll get an Associate of Science degree in robotic and automated technology. The graduates that we have from ICC with the robotics and automated technology degree go into companies around here that have manufacturing and that have specifically robots in their manufacturing or automated processes. When the student finishes our program, there are certificates available through various robotic manufacturers. The blue robots that we have here are called Yaskawas, and through the Yaskawa company you can get certifications for material handling, certifications for welding, certifications for paint applications, things like that. In our area, we've had an increase in robotic applications added to many of the companies here, so the job market is very good for a robotics technician. They generally start around $20 an hour, which is about $40,000 a year. So it's a really good entrance for a student of any age. So most all of the companies we have here now that manufacture products are using some kind of robot or some kind of automated process. So there's lots of opportunity in our area for good jobs. It's a really fun thing to get into. When you can program a robot and have it do something repetitively and you can walk off and leave it, to me that's gratifying. A robot does not need the air conditioning, it does not need the lights in the room to be turned on and that kind of thing. And it's just fun to work with. To enroll in the Robotics and Automation program at ICC, go to ICC's website, www.iccms.edu, and apply to the college first. Once you apply to the college and you're accepted, then there's an application process for the robotics program.
First of all, you gotta love what you do. I mean, you have to have a heart for it. That being said, those that do have the heart for it, the only thing I can say is to just go for it. Do it if you're scared. Do it if you don't have faith in yourself. I just decided to go back to ICC and pick up some courses, and in the process I found Food Pathways. I had worked in the hospitality industry prior to being a stay-at-home mom, and that was what I enjoyed doing. And after I got in school and got back into the hospitality industry, I realized that that's what I wanted to do, and that's what made me happy. One of the great things about having your own business is being able to make the decisions yourself and choose what you want to do for your customers, and being able to design things to work around your schedule. The Food Service Pathways program was more of a hands-on, kind of the bones of what the food service industry is. So you get in there and you learn really, hey, is this what I like? Is this what I'm going to enjoy doing? And as a business owner, those are things that I use day in, day out, sometimes hour by hour, minute by minute. Things such as profit margin, consistency, always measuring. There's things that we do every day that I want every one of my employees to be able to know also, so that every customer gets the same thing that they expect every time they walk in the door. ICC has been really great in holding my hand and walking me along every step of the way and keeping me going and giving me that motivation and initiative that some days I couldn't find on my own. Just be brave and do it. I mean, it's worth it. It's worth your time. It's worth your effort, and it'll pay off in the end.
Kirk Herbstreit is a man of many talents. Not only an athlete and a sportscaster, but also an expert cartographer, an amateur alchemist, a surprisingly gifted poet.
What rhymes with encroachment?
But his true talent lies in the art of banking.
With Renaissance Bank's great products, rewards, and easy-to-use online tools, every transaction is a masterpiece.
You might refer to Kirk as a Renaissance man.
But I call myself a Renaissance man.
This broadcast is being brought to you by Renaissance Bank, Little Caesars in Fulton, Tupelo Coca-Cola Bottling Works, the Orthopedic Institute of North Mississippi, Davis Ford, First American National Bank, TM Realtor Agent Ricky Murphy, Max Home, the ICC Baptist Student Union, Cagle Eye Center, Bank Okolona, Sam's Town Market in Mantachie, State Farm Insurance Agent Brandon Poland, the ICC Wesley Foundation, the ICC Foundation and Alumni Association, and donations to the Sports Information Indian Club from viewers like you.
They say Diet Coke is a mom's drink. Well, you copied her jeans, her spin, her shoes, her scrunchie, and whether you realize it or not, her music. Now, copy her drink. Drink what your mama gave you.
Here, you can be your best. The best train here. Learn here. Succeed here. Perform here. Win here. Thrive here. Itawamba Community College. The best start here.
Brought to you by Renaissance Bank, the bank that understands you. Learn more at renaissancebank.com.